Welcome, everybody. Well, we're getting right on time today with our very important COVID-19 update. We're joined by Dr. Rachel Herlihy, state epidemiologist. She'll be particularly giving an update on the South African COVID variant and our public health response around that. Brief update of where we are, 838 new cases today. Testing, 10,374. So we want to see a higher level of testing. It's important that everybody knows if you have flu-like symptoms, if you have fever, if you're feeling ill, it's so easy to get tested. It's free, quick, and easy. You can go to any of the testing sites. You can find them, covid19.colorado.gov. Very important that you identify that so that you can notify those you've been in contact with, your family, and be on the lookout for more severe symptoms. But we continue to be in this plateau. Very good news on hospitalizations. We hope it sticks. We're under 300. We have 299 Coloradans hospitalized from COVID-19. It is a great joy to see that number under 300. Of course, to put things in perspective, that's still 299 families who have a loved one in the hospital to COVID, praying for their successful recovery. Many will make it out, but unfortunately some won't, which is why we need to continue to be very careful, wear our masks, and avoid large gatherings as we rapidly deliver the vaccine, the highly effective and safe vaccine, into arms. We've begun work with really everybody over 60 can now get the vaccine in Colorado. Anybody who's 16 to 59 with two high-risk conditions can also access the vaccine. And we're hitting our goals and continuing to be one of the leading states in the country in getting the vaccine into arms. As of today, we're really blowing through our goal of vaccinating 70% of Coloradans 70 and up. We are now at 74% of Coloradans 70 and up. And I hope that goes even higher. I would encourage anybody to get the vaccine who's eligible, but particularly people in their 70s and 80s and 90s. If you've been waiting, now's the time to do it. It doesn't mean you missed the window just because we've opened it up. You still have priority if you're 76, if you're 86, if you're 96. We want you here. We want you to be safe. And the 74% would be a good number for the whole population, but we would love to see that edge even higher for people 70 and up, because 78% of COVID deaths in our state have been people aged 70 and up, and about 40% of hospitalizations. So as we continue to make progress with those 70 and up, and as well as those 60 and up and with existing comorbidities, it really helps bring about the end of the pandemic quicker. The good news is for people 65 to 69, about just under 60% of the population has gotten their vaccine, should reach 70% within the next week of people 65 to 69. And then just behind them will be the 60 to 64-year-olds now eligible. Absolutely. If you're anybody age 60 and up, whether you're 61, whether you're 71, whether you're 91, get the vaccine. It's free. No one can charge you. It's easy. There's sites all over the state, covid19.colorado.gov. Click on listed providers, and you can set up appointments to get that done. We've also begun the work around some of our hard-hit workers in our meat processing plants. I visited JBS in Cargill just a few days ago, in Fort Morgan and Greeley, along with our terrific Commissioner of Agriculture, Kate Greenberg. And I'm proud to say that as of yesterday, over 60% of Cargill employees have gotten their first vaccine. Thousands of JBS employees. JBS, they lost 6 workers to COVID-19. And because of the nature of what they do, the work they do, physical distancing isn't possible. They've implemented better safety precautions than they had in the early days, but it's a great relief to the workers and their families that we have begun making that available to all of those workers. And we look forward to continuing to identify more partners to protect the health and safety of people across our state as we continue to expand distribution as well. I was just on a call with the White House this morning. The good news is that whereas previously they had told us we'd be getting 0 Johnson & Johnson doses over the next week, remember we got 45,000 and they said 0, then it would go back up. We will be getting about 7,000 in the next week, so not 0, 7,000. In addition, we'll be getting about 10,000 more Pfizer and Moderna than previously anticipated. I would add that we have the plans to use every dose within 3 days of when we get it. We could absolutely administer even more than that, but we are very thrilled that the initial projections for the 3-week supply are being exceeded by the federal government, with approximately 17,000 more doses that we expect to receive over the next week. As you know, we began our teacher vaccination program starting February 8th. We had a goal of getting it done over a 3 to 4 week period, reserving about 30,000 vaccines a week for educators, childcare workers. Our goal was to have 75% vaccinated by last Friday. Today, I'm proud to announce that we have passed the goal of vaccinating 75% of kindergarten through 12th grade teachers. We estimate that about 108,000 educators and licensed childcare workers, about 90%, have received their first dose. And I'm just so excited. It's no surprise that well-educated teachers and others have a higher uptake rate of 90%. We've also seen similar uptake rates among healthcare workers. So I'm proud that teachers are leading the way and that 90% of teachers have decided to get vaccinated, and I hope that others follow that remarkable lead. Those are very, very strong numbers, really exceeding our goal of 75%. And frankly, even exceeding the percentage of 70 and up that have so far been vaccinated. So we'd love our older Coloradans to step up because they are at greater risk, and we would be thrilled if we can even approach 90% of those who are at greatest risk of the virus. And by vaccinating 90% of our kindergarten through 12th grade educators, it really brings us a step closer towards making sure that our schools will stay in, right? We've worked very hard to get them in. I had another governor from another state call me and say, how did you get your schools back in Colorado? We still haven't been able to do that. Well, it took a lot of work, right? Remember, we did the back-to-school task force, the layered protections. We involved teachers, parents, school districts, administrators, so many folks to really come up with the very best protections to keep our schools safe. They're essentially all open in Colorado. There are still some high schools that are on a 2-day-a-week schedule, but K-8 is back, and most high schools are back. And it's been a positive experience so far for the teachers, for the students, for the parents, and of course we want to continue to lead the way. And this will help with 90% of educators being vaccinated. We're also making leaps and bounds towards vaccinating more Coloradans every day. If you're 60 and up, or if you have 2 major preconditions that put you at risk, get vaccinated today. You can go to cocovidvaccine.org. or you can dial 877-CO-VAX-CO. And remember, if you are 60 and up, you are eligible, but that doesn't mean everybody who's 60 and up in the entire state gets it tomorrow. It might mean you get it next week. It might mean you get it the week after, but you will get it in the next few weeks. And there are people age 60 and up getting vaccinated every day all over our state. Yesterday, the CDC issued guidance for people who have been fully vaccinated. And that's either 2 doses of Pfizer or Moderna or 1 dose of Johnson & Johnson 2 weeks after that. So for me, I had my second dose last weekend, so I'll be considered fully vaccinated by this Sunday. And, that's a load off my shoulders. I plan to go out to eat at a restaurant for the first time in some time. And I know a lot of other folks that have been waiting a long time are willing to do the same thing. So they have that confidence, especially if they're in their 70s or 80s. They've been very cautious. My parents, fully vaccinated 2 weeks after their second vaccine. They went out to a restaurant. They went out, hadn't been out in a year. So, you have a high level of protection, and 2 weeks after your second dose, or in the case of Johnson & Johnson, 2 weeks after your first dose, you can, you still want to be careful, but you can resume your normal activities and feel confident about that. Of course, many people have been going out all along unvaccinated, and that's certainly their decision. But if you're in a particularly high-risk group, you can feel much better about resuming your normal lives. And I look forward to going out with my family shortly as well. And we've missed that, as have many Coloradans, and we look forward to supporting our local small businesses. We've certainly done that through takeout and delivery, but it'll be nice to be able to do that in person as well. With regards to the guidance, the CDC guidance indicates that it's safe to gather with other fully vaccinated people indoors without masks. So, if it's an event where everybody's been vaccinated, very, very, very safe environment. The CDC also indicated you can gather indoors with unvaccinated people from one other household. So that can be, just visiting together with friends. And if your family's been vaccinated or you're older and you've been vaccinated, you can finally invite your neighbors over for dinner, even if they're not vaccinated, once you're protected. So we can get the CDC guidance really allows for that additional level of socialization to get through this. And also noteworthy, if you've been exposed to someone with COVID-19 but you've been fully vaccinated, you don't need to isolate or quarantine. And that was another reason that it was so important to get the teachers vaccinated, because one or two cases in the class leads to the teacher and the entire class being taken out for 2 weeks. So in this case, if the teacher's vaccinated, they can still work and come in and help. There still might be quarantines of class members, but if there's 2 or 3 classes the teacher taught and one of them is out on quarantine, the teacher can still be able to work with the other 2 classes. So that's very good news for everybody. And we had indicated that with regard to education some time ago. But the formal CDC guidance is you don't need to have the quarantine period if you're vaccinated and you're exposed. And we also have wonderful news that, all 3 COVID-19 vaccines are very close to 100% effective at preventing COVID-19 deaths. Not 100% at preventing infections. They're very highly effective at preventing infections, in the 70 to 95% range, but very close to 100% at effective at preventing deaths, which is even more important than preventing infections. Also, of course, for now, because we only are at about 10% or 11% of our population fully vaccinated, of course, we're all still wearing masks when we go out, taking all the precautions. If anybody's experiencing symptoms, please go get tested. We need to get our testing numbers back up so we have the surveillance we need to know where the virus is. And we are continuing to make that easier and easier to do. And, of course, I'm hopeful that no one gets COVID from the result of this past weekend's maskless, thoughtless rager in Boulder. But sadly, given where we are with the virus, that's unlikely. It's highly likely that some transmission occurred, and that kind of behavior jeopardizes everything that we care about in our state. It jeopardizes lives. It jeopardizes higher education in-person experience. It jeopardizes the faculty of those institutions because they are, unless they're older, not yet vaccinated yet. And this is the kind of behavior that we can't afford yet as we work to continue to end the pandemic and vaccinate more Coloradans. We're not out of the woods yet. We've held on this long. I know that our college students want to party. They will be able to soon enough, but not today, not this week. Hopefully, around graduation time, they'll be able to safely rejoice in celebration of their achievements. Like other states, we all wish that we had more vaccine supply. Today, I sent out a letter with Governor Kate Brown of Oregon to Acting Commissioner Janet Woodcock of the FDA, urging the FDA to permit pooling of COVID vaccines. This is a very simple short-term emergency step that could allow for 5 to 10% more doses. It means if you have a quarter of a dose left in one vial, half a dose in another, a quarter in another, under clinically supervised conditions, under sterile conditions, those can be combined. That kind of process is routinely done in other areas at hospitals. It can be done in a very safe manner, and our providers and vaccinators see leftovers at the bottom of vials every day. Those could save lives, and it is incredibly frustrating that the FDA does not currently allow that. I hope that they act expeditiously on the request from Governor Brown and I. It's far from a new idea. Vaccine pooling is common. It's already used with flu shot and other shots. And this is a public health emergency. It absolutely calls for weighing the costs and the benefits. And in this particular case, the benefits far outweigh the risks or costs of being able to salvage that remaining 5 or 10% of doses to get it into arms to protect people sooner. And I want to thank Governor Brown of Oregon for her partnership on this issue. And I welcome leadership from other states as well to echo that request to get an affirmative response from the FDA. Due to the evolving nature of this virus, we have to be ready and on guard. Yesterday, 3 cases of a more contagious COVID variant, first identified in South Africa, were confirmed in Chaffee County. Unlike the UK variant, Colorado is not the first state outside of South Africa to have found the variant. Remember, we were the first to locate that. This variant has also been found. The South African variant has also been found in California, Texas, Florida, Illinois, and New York. And I want to hand it over to Dr. Herlihy to discuss what the discovery of this more easily spread variant means for our state, as well as the course of action that we take whenever we identify more deadly or more contagious or more vaccine-resistant variants. Dr. Herlihy.
Thank you, Governor. Good afternoon. So I wanted to provide you a quick update on where we stand with our investigation and response to these B1351 or South African variant cases that we've identified, and then talk a little bit about why this variant is different from some of the other variants that we've seen in the state. So as we reported on Sunday, our state lab has identified 3 cases of the B1351 variant in Colorado. This is the variant that was first identified in South Africa, and this is the first time that this variant has been identified in Colorado. Other variants that have been identified in Colorado include the B117 variant of concern, which was first identified in the UK, and we've had 265 cases of that variant, and the B1427/B1429 variant under investigation, and we've had 161 cases of that variant. We have not yet identified the P1 variant that was first identified in Brazil, though that variant has been identified in a number of states in the U.S. And neither have we identified the variant that is causing transmission in New York City and some parts of the Northeast, and that variant is known as B1526, and that is a variant under investigation. So the specimens that we identified the B1351 variant from were selected at random, really, for sequencing at our lab as part of our Sentinel surveillance system for variants in the state. Last week, we sequenced 264 specimens at our state lab as part of that program. We're very close to our state goal of 5% of specimens being sequenced, and we think that we will exceed that number in the weeks to come to really try and have a better sense of where these variants are circulating in our state. The B1351 cases that we identified are associated with the Colorado Department of Corrections in Buena Vista. 2 were among cases, and 1 was among an incarcerated person. It does not appear that the cases have a history of travel. All 3 were symptomatic. 1 appears to be a case of reinfection, and none of the individuals had been previously vaccinated. Our investigation is ongoing to try and identify a possible source of infection and identify all exposed people. We're in the process of testing all staff and incarcerated people at the facility, and we are also on site providing vaccination. Chaffee County has testing and vaccination capacity available throughout the county. And later this week, we will host a vaccination clinic for family members and close contacts of staff. At this time, it does not appear that there is widespread transmission of this variant in the facility. A small number, fewer than 10 positives, have been identified from the first 500 specimens that our lab was able to test yesterday. So a very small percentage of those are coming back positive. Those positive specimens will all be sequenced this week, but we won't have the results of that sequencing for several more days. It's a multi-day process. So far in the U.S., as of Sunday, when CDC last updated their website, B1351 has been identified in 20 states in the U.S., and there have been 81 cases. That data does not yet reflect the Colorado cases, so that should be updated, I would think, either later today or later this week. In addition to spreading more easily and more quickly than other variants, B1351 is a concern because data has shown that the variant may more easily evade the immune response that our bodies build through prior infection or vaccination. And this is because the B1351 variant genetics changes, so the mutations that occur in that virus really result in that virus looking a little bit different to our immune system. And so not all antibodies that our immune system has made can really grab onto that new variant quite as well. This means that some of the antibody treatments may be a little less effective than they are for other strains of COVID-19. A person who has already had the virus might be more likely to be reinfected with B1351 than other strains, and the vaccines may not work quite as well at preventing infection. But while the vaccines are not as effective, we are thankfully starting with really effective vaccines. As the governor mentioned, these vaccines are nearly 100% at preventing severe disease, and their effectiveness range for preventing symptomatic infection is from 70 to 95%. So because of this, we still think that these vaccines continue to play a significant role in protecting against this variant and continue to offer substantial protection, especially against severe disease. As always, everyone should continue to wear masks, practice physical distancing, wash their hands frequently, and get vaccinated when it is their turn. These continue to be our best tools for preventing the spread of this virus, no matter the strain or variant that it might be. Right now, 1 in 263 Coloradans are currently infectious with COVID-19. So these rates are still high, higher than our summer peak of illness. And so the strategies that we have been using continue to be critically important for us to continue to see progress that we have been seeing in decreasing our cases, hospitalizations, and deaths in the state. Thank you.
Thank you, Dr. Herlihy, for that thoughtful analysis. Really, any day now, perhaps today, perhaps tomorrow, Colorado will surpass 6,000 deaths from COVID-19. We had a memorial service at our beautiful state capitol, lit up buildings across our state, magenta, in honor and in memory of those who we lost. And while the worst days are behind us, there is still great risk. We will lose more Coloradans. Of the 299 people hospitalized, some will make it and some won't. There are people that will catch the disease in the coming days and weeks and be hospitalized. Some will make it, some will not. And don't let that be you. Don't let that be you. Wear a mask. Avoid social gatherings unless you're fully vaccinated. And let's get through this sooner rather than later. Thank you, and we're happy to take some questions.
Jesse?
Governor, can you talk about whether or not your health department is rethinking the decision not to vaccinate prisoners and people in other congregate settings given the outbreak at Buena Vista? And then also, are you taking any steps to ensure that prison guards are getting more vaccines, since I know that I think less than half of them have actually accepted it?
So we're not satisfied with the uptake of COVID-19 vaccine among prison guards, and we are hopeful that that will increase in the coming days and are working to develop the right kind of ways to do that. We there's always a public health plan where if there's more deadly variants that are identified, wherever they're identified, whether it's a nursing home or prison or simply a family or a school, wherever it's identified, we then surge vaccines to the impacted community, meaning in this case to the family members of all of the guards, to the prisoners who might have been exposed. We want to do our best. All of our public health relies on limiting the spread of these more contagious variants quickly and expeditiously. So we have the ability to do that, have since January. We are ready to deploy vaccines to contain outbreaks of more deadly versions wherever they occur, and no one can guess ahead of time where they're going to be. As I said, it could be at any setting, and we've had them in multiple kinds of settings, and nor does it by any means stigmatize other settings like that. There's, of course, many nursing homes, many prisons, and many other institutions across the state like that have not had outbreaks of these variants. But wherever the more deadly and more contagious variants arise, we will work closely with county health to provide a very robust and quick response in attempts to contain their further spread to our fellow Coloradans.
Afternoon, Governor. With the potential for a very large-scale snowstorm coming in, how's the state preparing for that when it comes to vaccine distribution? Do you have any messages for people who have or who might have appointments this weekend, worried that this could really impact them? And is this a short-term concern or something more long-term, like it had an impact down in Texas?
So short-term is the brief answer. As far as I know, there's been no vaccination clinics canceled yet, but stay in touch with yours, whether pending. For now, keep your appointment, keep your plans. If it's mild to moderate weather, I fully expect that everything will occur according to schedule. If there are areas of the state that are impacted by severe or unpassable weather, people will be notified by their provider, and those will be rescheduled within a few days because the vaccine is in hand. They're ready to go. It should not have a delay of more than a few days in being able to get the vaccine. We're not expecting any interruptions to the supply chain as there was with the last cold spell and storm. And of course, the other area we'll be watching is making sure that we do our best that there's no additional electricity bills or costs that are incurred because of natural gas costs during another cold spell.
Rick Salinger from Channel 4.
Go ahead and follow up.
You mentioned the 17,000 additional vaccines.
Yes.
I was just curious, given those and where we sit right now, is your timeline still intact for the next phase opening around March 21st and the general public getting the shots in late April, early May? Has that moved forward or back?
Yes, we'll be able to announce more specific dates next week for the next phase. Our estimate continues to be around March 21st for that next phase.
Governor Rick Salinger from Channel 4. We are seeing other states around us and around the country opening up fully, and you are getting calls even within your own state. When will Colorado open up fully, and what will it take to do that?
Well, look, most things are open. I mean, you can certainly, and have been for some time, you go out to eat. You can, Rockies opening day is going to have the bleachers will be pretty full, not, and I think probably as full as they are in nearly any other state. So everything's open. I hope you're able to do what you want to do, take your kids to the zoo, go out to a restaurant. I think what they might be talking about is when can you sort of pack in people a little bit closer at restaurants or bars. And that's happening. It's happening automatically with the dial. There's already a number of areas of the state that have upped their percentage. So I think, as I said, everything is open. Have fun in a safe way. We trust you. It's a matter of personal responsibility. And we hope that continues in the coming weeks.
And the mask
Yep.
will that continue indefinitely?
Yeah, so we've certainly been watching closely what other states do. Wyoming, for instance, is requiring it in schools for kids, but they're no longer requiring it among the general public. All of these things will be, phasing out, in the coming weeks and months. It's really just a matter of making sure that our most vulnerable are protected, and then working to localize that health response so that counties can choose, when and how to implement mask requirements. There's many municipalities that have additional mask requirements above what the state requires. What's important to note is that while we're at 74% of age 70 and up have gotten their vaccine, for some that's just their first vaccine. So when this really accelerates is once they are protected, fully protected. That means second vaccine in 2 weeks. So for folks 70 and up who got it that last week in February, right, that means in late March, they're getting that second vaccine, and then in early April, they're fully protected. And once we have Coloradans that represent 78% of our hospitalizations protected, the state nexus in the public health emergency is significantly reduced, because what is our state emergency? It's the very real risk of overflowing our hospitals. And it's 78% of deaths are people 70 and up, 40% of hospitalizations, but a majority of hospitalizations, people 60 and up. So once they are fully protected, then we're absolutely able to work more closely with local partners to have the appropriate public health response in each area. But in Colorado, everything's open. Again, especially for people who are vaccinated, you're much safer going out to eat now. I plan to do that for the first time since I did outdoor dining last summer with our family, and plan to go out next week and hopefully start going out once a week for dinner again. And feel better about that once we're vaccinated. And so many Coloradans, particularly those in their 60s, 70s, and 80s, once they have that full protection, will also have that confidence they need to be able to reemerge and go out and see their friends.
Hello, Governor Polis and Dr. Hurley. This is Benny Del Giudice, Bloomberg News in Denver. The J&J vaccine is out. I got mine. I'm in the age group. It went well. But statewide, have there been any serious reactions been reported with the J&J vaccine since it rolled out? Thank you very much.
I can take that question. None that I am aware of, but that data does sometimes take a few days to be reported to states from CDC's VAERS system. So we'll certainly be looking into that and tracking that over time.
And I've been vaccinated. I know many of my older friends and friends who are in law enforcement and teachers who have. And to a person, they've been sore the next day. Some were a little under the weather for a day, but it's very simple. It's very easy. I had no side effects, felt totally normal the next day, besides my arm being a little sore, just like the flu shot. And what you're feeling is actually, it's your own immune system responding, is all you're feeling. So, and that it's healthy. It's how all vaccines work. So it's easy. Side effects are minimal, just very similar to flu vaccine. And everybody who I know who's had it has had a fine experience, a good experience. My parents didn't feel anything the next day. Some people I know, where, as I said, were a little under weather the next day, but they were completely back to normal by the following day. And let me tell you, it's far better than having COVID. Speaking to somebody who's had COVID, whose partner was hospitalized from COVID, these relatively minor effects of the vaccine are far better than having to go through having COVID.
Hello, this is Meg Winketer from the I have a question, probably early. So with this, like the number of variant been saying more in these last few weeks, do you know to what extent that's a reflection of that they're actually more defined versus that you're seeing a larger sample?
Difficult to hear you, Meg, but I can try and...
Do you want me to try again?
Yeah. Sure, thanks.
Okay. Well, my question was, it seems like the number of... Can you hear me?
Not very well.
Huh.
Let's come back to you, Meg. Let's go to somebody else in the room, and we'll come back to you in a second.
Well, I think I'm not okay. Given the fact that there are some of these variant cases, is it possible that there are many more people in the community that have them? For instance, obviously prisoners are not traveling out of the country, so how did the South African variant end up in Chaffee County?
Yeah, let me address that globally before she drills down. The amount of monitoring is sufficient to notice if there are major upticks in the presence of the variants. They're absolutely not sufficient to know exactly how many people have the variant in our state, and absolutely there are people with the variant that go unidentified, no question. What we are watching and monitoring is whether there are major and rapid upticks in the presence of any of these variants among the tests that we do. Dr. Herlihy?
Yeah, so I think to comment specifically on the B.1.351 variant, as I shared, the cases that we have identified did not have a travel history. Our investigation is still ongoing. So at this point, we don't know if, we're one generation away from B.1.351 being introduced in the state or more than that. So hopefully we'll learn a little bit more through our investigation. But as we expect with these variants that are more transmissible, there's a reason that they've been spreading more rapidly, and that's they have a genetic advantage, right, that allows them to spread more easily. And so we expect that they will become more common over time. What we're doing right now with our aggressive disease control strategies, especially what we're doing in Buena Vista right now, is trying to identify all the cases we can using isolation and quarantine to really slow the spread, mitigate the impact of these variants in the state. With regard to B.1.1.7 or the UK variant, we have been tracking that now for many weeks in the state, and we have seen a slow increase in the amount of B.1.1.7 that is occurring in the state. So in the beginning, we were seeing probably 0 to 3%. Now getting closer to 3 to 6% or a little bit more than that in the state. And that's not unexpected given that we know these variants spread more easily. But we're also reassured by the fact that we're not seeing B.1.1.7 grow at the rate in Colorado that we saw it grow in the UK. So we're at a very different point in our epidemic right now compared to where the UK was when that variant was spreading. And so certainly good to see that it's not increasing at the same rate, but we do expect them to continue to spread over time.
Members or the prisoner who tested positive, had they been vaccinated?
No, and that was something I shared. So none of the cases had been vaccinated.
Is there a phone, or are we going in person?
Governor, you touched on the situation in Boulder last weekend. What went through your mind when you heard about that, and how great could the consequences be for keeping the university with in-person learning and the students in town?
Well, certainly disappointment, and I really agree with the disappointment that many of the responsible student leaders articulated, the student government articulated. Obviously, disappointed at the negative public health impact, but frankly, as much or even more offended and disappointed by the terrible property damage, the overturning of vehicles, the the damage that was done by the rioters. So it's obviously unacceptable behavior. I know that both the university as well as law enforcement are working to hold perpetrators of violent acts against property accountable, and I fully support that process. With the larger public health picture, it was one isolated event. It was outdoors. I'm sure that there's likely some transmission that occurred. Obviously, they're generally low risk demographic, younger people, but the danger is less to them than it is to their not yet vaccinated faculty and instructors and others in the community.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado. Gobernador, el estado de Texas ya abrió el 100% y algunos condados aquí en Colorado solicitan abrir la economía totalmente y relajar restricciones. ¿Qué opina usted de esto y cuándo cree que Colorado volverá a la normalidad?
Yo quiero abrir todo al igual que ellos, pero quiero asegurarme que más personas están vacunadas y cada día más y más estén vacunadas, especialmente las personas mayores de edad. Tenemos que asegurarnos que ellos tengan inmunidad antes de poder abrir todos, pero todos ya está abierto. Por ejemplo, restaurantes, parques zoológicos, parques, tiendas, todos están abiertos, pero sí tenemos más espacio y tenemos que asegurarnos que ellos tengan inmunidad antes de regresamos al normal. Espero poder dar más información en las próximas semanas muy prontos en cuanto a este tema.
Excuse me, Governor Charles Ashby from the Grand Junction Daily Sentinel. So it seems that we haven't been hearing a lot about side effects from taking the vaccine, that people were afraid to take it. There have been no reports of people turning into space aliens or growing a tail. I'm wondering if you're getting a sense that more and more people are beginning to accept the vaccine, and that's what's getting us to the numbers where we are.
Yeah, helps the word of mouth. I had a vaccination clinic 2 weeks ago in Denver in a parking lot of a predominantly black church. Met a woman in her 70s who was the first from her group of 5 girlfriends to get the vaccine. And once she got it and they saw that it was fine, she was bringing her her 5 girlfriends in to get it. And that's what we see. As it becomes more and more normal, more and more people get it. Your kids' teachers have had it. The seniors living in nursing homes have had it. When it's your turn, you can get it, and you should get it. The benefits far outweigh the very minor inconveniences that you might have the next day. And that's it. Thank you very much. Stay safe, Colorado.